5 dangerous vaginal discharge you should worry about. Vaginal discharge is a normal and healthy part of a woman's reproductive system. It helps to maintain the vaginal environment and keep it clean. However, changes in the color, consistency, odor, or amount of discharge can sometimes signal an underlying health issue. In this video, we'll explore the different types of vaginal discharge, what's normal, and when to seek medical attention. Stick around for a concise yet informative overview. Vaginal discharge is produced by glands in the cervix and vagina walls. It's typically clear or white, and its consistency can vary throughout the menstrual cycle. The amount of discharge can also fluctuate based on hormonal changes, sexual arousal, and pregnancy. As a lady, these are 20 facts about your vaginal discharge that you should know. 1. Vaginal discharge is a normal bodily function that helps maintain vaginal pH and protect against infections. The consistency and amount of vaginal discharge vary throughout the menstrual cycle. 2. The color of vaginal discharge can indicate hormonal changes, ovulation, or potential infections. This will be discussed in detail later in this video. Understanding these variations helps in early detection of health issues. 3. Clear or white discharges are usually normal and are common throughout the menstrual cycle. This discharge can become stretchy and egg white-like during ovulation. 4. Estrogen and progesterone levels affect discharge characteristics. Fluctuations in hormones can cause changes in consistency and color. 5. Clear, stretchy discharge often precedes ovulation. This is a fertile sign for those trying to conceive. 6. Green or yellow discharge indicates a potential red flag. Often indicates a bacterial or sexually transmitted infection, STI. This is usually accompanied by itching, burning, or foul odor. 7. Brown discharges do not always present a concern. It's usually old blood from the previous menstrual cycle. It can also occur after sex or during pregnancy. However, if accompanied by other symptoms, consult your doctor. 8. White or cottage cheese-like discharge indicates yeast infection. It's usually thick, clumpy discharge with itching and irritation, often caused by an overgrowth of candida fungus. 9. Grayish discharge with a fishy odor indicates a bacterial vaginosis. This is caused by an imbalance of bacteria in the vagina. It may also be accompanied by itching, burning, or pain during sex. 10. When you experience a bloody discharge between periods, it's important you seek immediate medical advice. This can indicate various conditions, including pregnancy, STIs, or hormonal imbalances. This is very important so as to rule out underlying causes. 11. Vaginal discharge serves as a cleansing agent. It helps to remove dead cells, bacteria, and other debris from the vagina, thus maintains a healthy vaginal environment. 12. Stress can lead to changes in discharge due to hormonal fluctuations. Managing stress can contribute to overall vaginal health. 13. Vaginal discharge increases during pregnancy. The increased discharge is common due to hormonal shifts, and it helps protect the vagina and cervix during pregnancy. 14. Certain foods and hygiene products can influence discharge odor. Mild variations are normal, but strong or unpleasant odors may indicate an issue. 15. Some medications can affect the composition of vaginal discharge. Consult a doctor if you notice significant changes. 16. Hormonal birth control methods can modify discharge characteristics. Changes are usually normal, but consult your healthcare provider if concerned. 17. Apply a gentle vaginal hygiene always. Avoid douching, scented soaps, and harsh cleansers. This helps to maintain a balanced vaginal environment. 18. Persistent discharge changes should raise a concern. Unexplained changes in color, odor, or consistency require evaluation by medical professionals. Early detection and treatment are essential. 19. STIs and other infections can cause unusual discharge symptoms. So practice safe sex and regular checkups for the safety of yourself and others. 20. Discuss any concerns or changes in your vaginal discharge. Early intervention can prevent complications, so open communication with your healthcare provider at earliest stage is essential. Now let's talk about when to worry about abnormal vaginal discharge. When you notice any of these changes in your discharge, it's safer to seek medical attention. A green, yellow, or gray discharge often indicates an infection. A fishy or foul odor can be a sign of bacterial vaginosis. Thick, clumpy, or cottage cheese-like discharge may suggest a yeast infection. Excessive discharge or discharge accompanied by itching, burning, or pain needs immediate medical evaluation. Any unusual bleeding between periods should be reported to a healthcare provider. Common causes of abnormal discharge: bacterial vaginosis, an imbalance of bacteria in the vagina; yeast infection, a fungal infection caused by an overgrowth of candida; trichomoniasis, a sexually transmitted infection, STI. Other STIs, chlamydia, gonorrhea, and trichomoniasis, can all cause abnormal discharge. Pelvic inflammatory disease, PID, an infection of the reproductive organs. Tips to preventing vaginal infections: 1. Practice safe sex. 2. Avoid douching, as it can disrupt the vaginal pH balance. 3. Wear breathable underwear. 4. Wipe from front to back after using the toilet. 5. Limit the use of scented products in the genital area. Now, when should you consider seeing a doctor? If you experience any of the following symptoms: A. Unusual changes in vaginal discharge such as color, odor, consistency, amount of discharge. B. Pelvic pain or discomfort. C. Fever. D. Painful urination. E. Abnormal vaginal bleeding. And F. If you have any concerns about your sexual health. In conclusion, while vaginal discharge is normal, it's essential to pay attention to changes in its appearance and consistency. If you notice any abnormal symptoms, don't hesitate to consult a healthcare provider for proper diagnosis and treatment. Thank you so much for watching. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more health tips, and share it with your friends.